Let's go ahead and move on. Let's talk about The View, my favorite block, the E block, the media block. So we can't play what exactly happened on Bill Maher's show because HBO is very litigious whenever it comes to copyright and all of that. So I'll try and describe it to you. Bari Weiss appeared on Real Time with Bill Maher, in which she had a clip which went viral. Now, personally, I didn't think it was all that special. I mean, credit to her, but she's basically been saying what we've been saying here for a long time, what a lot of people have been saying. She said, quote, I'm done with COVID. She talked about how she was wiping down her groceries. She watched Tiger King. She said that the vaccines were obviously given as the off-ramp in order for stop government-induced safeguards. You get the vaccine, you don't get back to normal. Now it's been 2 years, we don't get back to go. You find out cloth masks don't work. You realize you can show your vaccine passport at a restaurant, still be asymptomatic and be carrying Omicron. You realize, most importantly, this is going to be remembered by the younger generation as a catastrophic moral crime. I agree with all of that. Congratulations, Bari, and I guess for getting it out into a mainstream audience. Well, the mainstream is freaking out at this light suggestion that they are actually the crazy ones. First, she was attacked by The View in just an incredible clip where they basically suggest we'll be wearing masks forever, just like we have terrible TSA theater. Let's take a listen.
You know, listen, nobody on the planet really wants to go through this. This is not something we're doing because it's, sexually gratifying. This is what we're doing to protect our families. And you don't have to do it, but stay away from everybody. Because if you're the one who's not paying attention and you're coughing and sneezing, you don't want to, then stay out of the public, man. This is not, nobody wants this. I don't want it. And I think he's forgetting that people are still at risk who cannot get vaccinated. People who can't get that. Little kids under the age of 5. Yeah. Or people with health conditions. How dare you be so flippant, man?
There's still people they're over it, like a relationship. I'm over it. I don't feel like seeing him anymore.
To the post-mask part, because I think there's a prudence we've learned with the mask, the hand sanitizing that kind of like 9/11 with flying is always going to be here now. There's a new normal.
Oh, it's a new normal. No, it's not. You can live that way if you want. The rest of us are not going to. And the vast majority of people don't want to be as miserable as these people are. I don't know how many times we have to do this. This cudgel that they try and use with kids is outrageous. COVID is not a threat to the vast majority of children in this country. The flu is actually much worse for them. And even for the general population. This is a simple fact. Vaccines turned COVID into the flu. We should celebrate that.
Yeah.
We have created a gigantic scientific miracle. We have vaccinated and now have natural immunity in a huge portion of the U.S. population, adult population, which was at risk. Those who are at risk, age 65 and older, go get a booster. Data has come out that shows that their hospitalization rate is the same for 25-year-olds or whatever, whenever you get your booster shot. Great. Go ahead. The rest of us, we don't have to live like in complete misery. And it's just amazing to me that something as anodyne as Bari's message is being attacked. She's pro-vaccine. It's not enough for these folks.
So I don't have any issue with what this lady, I think her name is Sarah.
Yes.
Something.
Yeah, who are
what she has to say.
Yeah.
She indicates that for her personally, she plans on always wearing masks and stuff.
Go for it.
Fine.
Yeah.
I don't have a problem with that.
No, I
I'm not gonna be mad at people.
have zero issue.
I mean, people can be kind of gross, and we have a lot of germs. If you want to wear a mask around, like, fine. I have no issue with that.
Yeah.
I do have an issue with the weaponization, as you said, of kids. Listen, we all, in the normal range of American life, care about kids. We care about our kids. We care about other people's kids. We care about doing whatever we can to keep people's kids safe. At this point, we have data that shows that the interventions with kids specifically that we took were much more damaging to them on balance than the virus was. That's not to erase the several hundred kids who perished from this disease, and there's no making up for that. But we weigh costs and benefit and risks in our lives all the time. And again, when you look at school shutdowns, when you look at what the American Academy of Pediatrics said was a national crisis for young people in this country in terms of their mental health, when you look at addiction, when you look at depression, when you look at learning loss, when you look at the delayed IQs that we've seen, all of these things paint a very compelling picture that there was greater harm to kids from closing schools and even from, the masks. There's not great evidence that masks helped to stop the spread in schools. There's not even good evidence that closing the schools helped to stop the spread of the virus at all, okay? So this very easy and cheap talking point of, I guess you just don't care about the kids, is really just unfair and untrue. One thing I do want to say about Bari's comments, that the younger generations will look at this as a moral crime. I'm not sure that's true, and here's why. Because there was just polling out in New York Times this morning showing that even though younger people are, by the data, much less at risk for COVID, they're actually much more in favor of coronavirus restrictions than older people, all because they tend to be on the left of the spectrum versus older people tend to be on the right of the spectrum. They also, in their personal lives, are more afraid of COVID than people who are older, which is, again, doesn't fit with the science. It only makes sense when you look at the fact that, there's a partisan skew in terms of how people ultimately feel about the virus. So you have, on the one hand, folks who are on the right side of the spectrum who tend to underestimate their risk of disease and how severe it could be, especially if they remain unvaccinated. And then you also have people who are overestimating how vulnerable they are. That's ultimately leading to, to a lot of fear in their personal lives, and in some instances, bad public policy as well.
Yeah.
It's so hard to find anywhere where these things are just like acknowledge, where you're actually trying to sort through the science in a real way, not an ideological way, when you're really trying to weigh the costs and the benefits. There's just a lot of partisan thinking on both sides of this issue that's frustrating.
See, to me, the moral crime is that young people are afraid. I don't think they should be afraid. I think it's a terrible thing in order to be afraid whenever you're young.
Well, the media is a lot to blame for that.
Yeah, and they are the people who gaslight.
They've really done a poor job of explaining clearly the relative levels of risk depending on where you are in society. And when you paint with a blanket brush, then if you're a person who's, consuming that type of media, it makes sense that you would internalize that as, I personally need to be afraid, even though in fact your own personal risk profile is much lower than someone who's, say, old, overweight, unvaccinated.
And yet, what is the nuance that we hear over on CNN? Well, take a listen to the same reaction.
Dr. Reiner, to you first, because you did call out Bari Weiss on Twitter. You told her to grow up. Tell us why, you had such a negative reaction to her comments.
Well, first of all, her behavior was childish, which is why I told her to grow up. She ranted about how inconvenienced she has been by this pandemic and how it's not real anymore. Well, I'll tell you that for the 10,000 Americans who died last week and for their families, yeah, it was damn real. And for the people who, struggle to keep them alive, and for the thousands and thousands of healthcare workers who have been doing this nonstop for 2 years, her behavior was childish and selfish. Look, this pandemic has gone on, in large part because the virus has mutated, and 25% of the American population, of the adults in this country, have decided not to get vaccinated. Now, she may be frustrated, that, life isn't normal, but we are in the hottest point of this pandemic in the last 2 years. Now, thankfully, in places like New York and DC and Boston, the virus is starting to recede. But, we've lost 860,000 people, and I'm afraid that by St. Patrick's Day, we're going to be staring at 1 million people dead in this country. And to hear, somebody who has such a large platform like Ms. Weiss sort of say, she's done with it, it's not real, it's a pandemic of the bureaucracy. No, this is a very real pandemic, and 1 million people in this country will have paid the price.
No, first of all, Bari Weiss. I'm like, you don't know how to pronounce her name? It ain't hard, Brianna Keeler. Second, this is such a disingenuous argument. The vast majority of those deaths occurred when people did not have access to the vaccine. And then many of the people who are dying themselves are the people who have, per the CDC, who are vaccinated up to 4 comorbidities. And this will sound callous. Something was going to take those people out, okay? Cold can take you out when you're that sick. The flu can take you you out when you're that sick. You're in a very vulnerable state when you're that immunocompromised. I feel sorry for you, but we don't shut society down whenever it comes to that. And especially in what he's saying around the healthcare workers and the weaponization of that. Nobody is denying that it isn't hard to work in the healthcare profession, but that's also your job. We do not shut down all of American society because the ICU capacity, it goes from 65 to 72%. We simply don't do that. And as you said, there is no consideration here of any of the risks. Do you hear anywhere on national television about how recent developmental studies of children find them 2 standard deviations below the normal baseline of the general population? 2 standard deviations. That is a catastrophe. Ask any person who's a teacher right now. They say kids are more unruly. They are, a lot of them have been not socialized properly for years. Their learning disability has increased. Math scores are plummeting. Testing, and you talk about this all the time, sometimes it's closed and it's open, and then, now he needs a test because he was exposed to somebody and it cost me $500 or whatever out of pocket. This is madness in terms of, and I didn't even talk about the adults, in terms of suicide, fentanyl, alcohol, drug use. I can go on forever. There's none of these that are being reflected in this piece, and I just find it so dramatically disingenuous, Krystal.
What I find gaslighty about what he does here is, on the one hand, he starts off by expressing so much concern for the, I think it was 10,000 people 10, that he said died in the week before. And then he quickly switches to, and we know from the data that those people overwhelmingly were going to be unvaccinated people, because if you're vaccinated, you're pretty well protected against hospitalization and death, unless you have just a massive number of comorbidities, as you said. So we know overwhelmingly those 10,000 people were going to be largely unvaccinated. So he starts by expressing all this concern for them, and then he turns around and is, really blaming and sort of shaming this very same population. And it's like, okay, well, listen, we need to have a perspective at this point of adults, some certain percent, it's actually smaller than you think, have made a decision, I'm not getting any of these doses.
Oh yeah, his data is wrong. It's not 25%.
So he said 25%. Yeah. I suspect that is the number who haven't gotten 2 doses.
Exactly.
Because if you look at people who have gotten at least 1 dose, it's 85% of the adult population. So you're actually only talking about 15% of the adult population, which is not great, but not terrible, who have decided not to get any dose at all. And at a certain point, I think you have to take the perspective that, say, Jared Polis has, and said they've had their opportunity, and, we're going to continue to encourage them to get vaccinated because that'll be the best thing to protect them. But especially since the government's not coming in with any more checks or backstopping business or any of that anymore, we have to move forward and, based on the data and the science, look at what the relative risk is for these different populations and make appropriate decisions. So I just think that they use facts in a way that is very gaslighting and disingenuous ultimately. And I do have to say, I think the most compelling argument on the side of people who are in favor of stricter pandemic lockdowns and these sorts of things is the overwhelming burden on the hospital staff. Because I do feel bad for those healthcare workers who have been through hell, and there have been so many resignations and the staffing levels are down and all of that stuff. But if that's where the issue is, let's flood the zone with resources. Let's pay people more. How about that? To get more nurses and doctors into these facilities. And oh, by the way, part of why we have these shortages in terms of beds available and in terms of capacity is because of our for-profit healthcare system that has led to all of these hospital consolidations, so that we are in this kind of a vulnerable situation when we really need to have that capacity.
Yeah. And to the extent that most of them are exaggerating. And I know this sounds callous, I'm sorry, but they never tell you ICU capacity is supposed to be 65%. These things are expensive to run. So when they're it's at 75, it's 10% above baseline. In many cases, we do not see triage care being vast majority across the country. The way that this is being exaggerated is just ridiculous to the nurses out there and the people. I stand with you. I want you to get paid more. I think it's outrageous that, your hours are ridiculous and that there's not people there, but that has a very easy solution as well. And so, if also the government has not expressed any interest in doing anything about that.
No,
and in that situation, what are we supposed to do? I'm not going to be held hostage because ICU capacity is 10 or 15% above baseline. And neither should everybody else. And I'm relatively much more free than most people. I can't even tell you the stories that I hear all the time. I've tweeted about this Johns Hopkins kid who has a medical exemption from the booster shot from his doctor, and the university rejected it and said, we're going to expel you. I know people who work office jobs required to wear one mask and then put a KN95 over it and then still come into work so that the bosses can monitor them. Oh, and they're not allowed to eat in the cafeteria. This is nuts. We can't live this way. And, to see the backlash against that by these freaks who are sitting at home thinking that we should all be like in a penal colony because, things are harder for them at work, and then exaggerating risks to children. As you can tell, I'm getting hopped up. But it really, when I see what happens to these young kids, it drives me crazy. Their lives are being ruined, and it's because of people like this.
One last note here. The polling says that, especially in terms of kids in schools, even though our opinion may not be what you often hear on these channels, it's like 2/3 to 1/3 in recognition that they're more concerned about learning loss from their kids not being in school than they are of risk of getting sick in school. So, and that's with the media, being wildly irresponsible with helping people understand where the real risks lie. So
Well
there you
said.
go. Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut, our reactions to each other's monologues. You get to listen to it. You get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.